Audio Jungle. This is High-Tech News TV News. Chennai ICAD Institute of Cardiac and Aortic Disorders team at SIMS Hospitals Vadapalani successfully treated a rare cardiac cause of hoarseness of voice and breathing difficulty in a 66-year-old man through multiple complex surgical interventions. The team headed by Dr. V Bashi, director and senior consultant, performed a coronary artery bypass grafting on a beating heart, followed by stenting on the aorta in the staged procedure. Thus, not just adding years to the patient's life, but adding life to his years. Other members of the team included Dr. Aju Jacob, Dr. Murali, Dr. Mohammed Idhrees, and Dr. Arunkumar. Patient history and line of treatment. A 66-year-old man patient, an American citizen originally from Bangalore, was evaluated for breathing difficulty and hoarseness of voice. Following a treatment with an ENT surgeon for 2 months, he was referred to a pulmonologist for his breathlessness. A preliminary diagnosis of chronic obstructive lung disease was made, but a chest X-ray revealed an abnormal shadow, calling for a CT chest, which showed a large aortic aneurysm of 7 cm. Having been diagnosed with an aortic aneurysm, he was referred to us for further evaluation and management. Since he had breathlessness, we decided to evaluate his heart to echocardiogram showed that he had moderate dysfunction of heart muscle, owing to which we decided to do a coronary angiogram that showed severe blockages of all his arteries supplying the heart muscle. Post the preliminary investigations, we concluded that this patient required two procedures: one, a coronary artery bypass grafting, and the other, a treatment for aortic aneurysm. We know by performing both simultaneously as a combined procedure, we would be risking the patient's life. On the one hand, if we perform the CABG first, there would have been a risk of rupture of the aortic aneurysm in the post-perfective period, which would have proved lethal. On the other hand, while performing the procedure to treat an aortic aneurysm, he could have sustained lethal cardiac complications. Adding to his complications was kidney dysfunction. Highlighting the complications of this case, Dr. V Bashi, director and senior consultant, said, keeping the above challenges and the critical stage of patients' medical conditions in mind, our dedicated team of doctors planned to proceed with the staged procedures intervention. On receiving the consent from the patient's relatives, we decided to go ahead with the planned intervention, where we were set to perform one procedure after the other in a controlled manner. As a team, we decided to do the CABG on a beating heart as the first procedure, and then stenting of the aorta. The use of heart-lung machines during CABG carried additional risk for rupture of aortic aneurysm. Performing CABG surgery for patients with damaged heart muscle like this patient required a balloon support, where a balloon is placed in the aorta to support the heart. Unfortunately, this was not possible for him because of his dilated aorta, as placing the balloon could lead to rupture of the aortic aneurysm. So, with utmost care, we did bypass surgery on a beating heart without the need for a heart lung machine and the balloon pump. All through the procedure, we ensured his blood pressure was under control. He had an uneven post-operative recovery with the proper medications for 6 weeks. Post which was admitted again for the treatment of his aortic aneurysm, he underwent a successful stenting of the aorta, which the heart tolerated very well. Today we are glad and thankful that he has recovered from both the procedures, and we strongly believe that the timely diagnosis and staged treatment was responsible for his smooth recovery. Dr. V Bashi added that all breathing difficulties do not necessarily arise from lung disease alone, but also because of underlying heart disease, which may remain silent. He stressed on the importance of regular master health checkups, especially for high risk individuals who are in their old age and the ones with diabetics and hypertension too. Besides, these life-threatening disease like an aortic aneurysm can also be picked up, he concluded. Want to know the latest updated news? Please subscribe High Tech News TV channel. Thank you.